Hi class, I wanted to show you how to go about using your Typodont at home for practice. I really want you to take the time to practice instrumentation on your Typodont every day for about 15-20 minutes, and I want you to feel comfortable and confident doing that. So I'm going to show you how to do that from your house. First thing I want to go over, because we just learned instrumentation, the basics of that this week. I want to show you what and how we expect you to show you some of the initial line items on your instrument movements, orientation, and adaptation competency. The first one is that, and you won't need your Typodont for this, we want you to show us what digital activation is. So you're going to pick up an instrument, it could be a probe or explorer, and you're going to use your modified pen grasp, and you're just going to show us what digital activation is with your fingers and then wrist. And we're going to be making sure that as you do digital activation and wrist activation, that your wrist remains in a neutral position. Then when we ask you to show us what rolling is, same thing, you're going to apply your finger rest or your fulcrum on your non-dominant hand, and then you're going to use your thumb and your index finger to roll your instrument and just show us, demonstrate to us that you know what that technique is. And then while you are maintaining your fulcrum, then you're going to show us what pivoting is. So those are the first steps of the competency. And now I'll show you how to get started working on your Typodont. Okay, so now the first thing that you want to do when you're working on your Typodont is you want to remember the basics, the positioning. So in the clinic, we always tell you that you need to position 3 things before you get started. You need to position me or yourself, your patient, and your equipment. So you want to think about where you're going to be working in the mouth and what clock position you need to be in. Okay, so if I am going to work on teeth 8 and 9, then if I were to do surfaces away from me, then I'd be sitting at 12 o'clock. And so right now, this is me sitting in 12 o'clock in relation to my patient, okay? Orientation with the probe. Remember that the probe, the working end of the probe, is actually the entire portion of the probe where you see the millimeter increments. It's from the tip to the bend in the shank, okay? So that is the portion of the probe that we want to make sure is lined up with the long axis of the tooth. So if your instructor says, show me tooth number 8 on the facial, you're going to show us how to orient the probe on the distal, on the facial, and on the mesiofacial, okay? And we want to make sure that you know that the whole working end needs to be in line with the long axis of the teeth, that you know that the teeth are tilted in the arch, that they're not vertical up and down. And if that were the case, your probe would be oriented more like this. But you can see that the tip is off the tooth, so that would be incorrect. Remember, teeth are tilted in the arch and they're kind of cone shaped. So you need to make sure that your working end is in line with the long axis of the tooth, so your tip is always in contact with the tooth and adapted. Now on a posterior tooth, I'll show you. So if I were to go to number 19 on the buccal, lower left first molar, I'm right-handed, so that would be a posterior surface away from me. So that means I would have to move up into the corner at 10 to 11 o'clock, which would be about here. And then I would grasp my instrument, place my fulcrum, and then I would orient the probe on the distal buccal, the direct buccal, and the mesial buccal. If my instructor said number 3 buccal, I know that's a surface towards me, so I would have to move to either 8 or 9 o'clock. So I would be on the side of the patient. And so that would look like this. I'd be facing the patient at 9 o'clock. And I'd apply my fulcrum to the maxillary arch. So I have my modified pen grasp and my palm is up. And I'm going to orient the probe on the distal buccal, direct buccal, and mesial buccal. Now I'll show you a lower anterior tooth. So if my instructor said, I want you to show me number 24 facial, I know that the lower left canine is 22, and then the lateral is 23, and the lower left central incisor is 24. So this would be 24. And we want to make sure that you know your tooth numbers and you're on the correct tooth. And I apply my intraoral fulcrum, and my palm is down, and I'm orienting on the distal facial, direct facial, and mesial facial. So that's all with the probe. Now with your Explorer, you want to make sure that you're keeping the handle, not the working end, but the handle in line with the long axis of the tooth. And then remember, we treat posterior teeth and anterior teeth very, very differently. So let's start with the posterior teeth. If I was going to work in the upper right buccal quadrant, then I would first get into my correct position. I would be in the 8 to 9 o'clock position looking at my patient like this. And now I need to find my working end. So I'm going to take the tip of the Explorer and I'm going to insert it between the premolars. And I want to make sure that the bend is going to the back, and that is the correct working end. If it's incorrect, let's see what that looks like. So this would be incorrect. The bend is going to the front of the mouth. So I'm going to get my proper working end again. Now I'm going to secure my fulcrum. I have a palm up intraoral modified pen grasp. And then what we want to see for the instrument orientation, movement, and adaptation competency is that you know how to find the right working end. You can properly activate your instrument by rolling and pivoting, and that you can show us multi-directional strokes. So our sequence on a posterior tooth is always to start with the distal line angle. That could be on the lingual or on the buccal. And then your tip is always driving in the direction you're going in. So my tip is pointed distally, and I'm at the distobuccal line angle. And now I'm going to walk my probe distally, I'm going to come out and roll. And now my tip is pointing mesially because that's the direction I'm going in. I go back to the line angle. I can show my instructor. I know how to do vertical strokes. I raise my handle a little bit more, oblique strokes, raise my handle until my handle is horizontal, horizontal strokes. And I continue to roll and pivot as I go along the mesial. When you're actually exploring and you have a competency later on in the term for doing the 11-12 Explorer, that is when we expect you to go subgingival and stay subgingival the whole time. For this first competency, the movement, orientation, and adaptation, it's okay if it's above the gum line or just right at the gingival margin. Now for an anterior tooth, we treat these teeth much different. So I'm going to work on teeth 8 and 9 because it's easiest for you to see. And I'm going to do surfaces away from me first. So I moved to the 12 o'clock position. Remember, anterior teeth, we are dividing the tooth in half at the midline of the tooth. And then we choose a working end. And we go to the midline, and our handle needs to be in line with the long axis of the tooth, and we want our tip pointing in the direction that we're moving in. So my tip is pointed in the direction of surfaces away, which would be correct. My handle's in line with the long axis, and I can see that the tip is not hugging the tooth. It's actually poking outward towards the tissue. So that is the incorrect working end. So I flip. And now I'm just going to double check. I have my tip pointing in the direction I'm working in. I have my handle in line with the long axis, and now the tip is wrapping the surface so that I know this is correct and I'm ready to get started. And now I pivot. I'm doing vertical strokes. I could do some oblique. Continue to move across the surface. I'm rolling, I'm pivoting. I roll until I'm under the contact. And now to do the surface towards me, for maxillary anterior, I can either stay at 12 o'clock or I could move back to 8, which is what I like. I already know that the opposite end would be my correct working end to do the surface towards me. So I flip my instrument one time. I have my modified pen grasp and my fulcrum. I'm going to the midline and I'm ready to start, and I'm pivoting and I'm rolling until I reach under the contact. Well, I hope that you found this video helpful, and I hope that it gave you some confidence, so when you're practicing instrumentation at home, you can follow along, and you can be rest assured that you're not doing anything incorrectly. If you are practicing at home and something feels awkward or something seems confusing, please write it down. Bring that note to school. You can talk to me about it or any of your other wonderful row instructors, and we will help you figure out what's going on and help you get to a place where you feel really confident at home. Have a great day. Bye.